Dr. Nardi here, back with another video. And in this video, we're going to talk about the advantages of within subjects designs and actually some disadvantages, and we'll get into some more complex designs. So let's talk about it. What's a between subjects design? That's simply a design where subjects are put or participate in more than one condition. So they serve in multiple conditions. Now, the benefit to this is you need way less participants. So normally in a between subjects design, you need about 30 people per condition. And if you have two conditions, that's 60 people. But within subjects design, you only need 30 people because they'll serve in both conditions. However, you have to be aware that sometimes there are carryover effects. Now, carryover effects happen when you have participants who are in one condition serve in another condition. Now, if that's the purpose of your study or the focus of your study, then that's a great idea. However, sometimes we don't want that. So that could be a negative impact of within subjects design, is that carryover effect. Also, since the subjects are their own controls within subjects design, then this is great at reducing error effect that comes from individual differences. So to really get rid of individual differences, you could use a within subjects design since the participants are in both conditions. But be warned of those carryover effects, as I just stated. Sometimes there's also what we call practice effects. Now, usually the more you do something, the better off you get. So if I give you a test on, I don't know, history, and then I do an intervention, and then I give you another test on history, you might just get better by practicing it. That is an issue. So sensitization is a process in which one becomes susceptible to the given stimulus. And this is discussed as one context effect in or within subject design. Now, suggestions could be to alter the treatment level gradually to avoid detection and or to vary other aspects of the work environment systematically to avoid the sole focus of the treatment variable. So you do not want the participants to become aware of what you are researching. Now, there's some ways to deal with carryover effects. One way is to separate the administration time. So give a long lead time between you give one, like if you're giving two tests, give one test and then wait a little bit, like a couple weeks to give the next test. That would help get rid of those carryover effects. Now, there's also differential carryover that can be problematic, which cannot be addressed through counterbalancing, which we'll talk about a little bit later. And here the carryover effects vary depending on what has preceded them and what is being tested in the condition. So depending on the order, so there's a little bit of order effects creep in. The other issue you run into is some treatment effects may not be reversible, such as exposure to a kind of therapy intervention. So in this case, putting more time between this experience and another condition will not eliminate the effect of therapy intervention entirely. Now, some researchers would argue in terms of external validity that within subjects designs are more appropriate than between subjects designs. Because in the real world, we're typically bombarded by competing messages. Thus, within subjects design should really not be rejected out of hand as a choice for the researcher. Let the research question guide the type of design you do. But the other issue you run into is subject mortality. And this is where there's differential dropout between your subjects. Now, subject mortality is a big issue with between subjects designs, but it's not really an issue within subjects design. However, there is a problem in that when any participant drops out, you have a loss of power because each participant is in all conditions. So remember, usually the larger the sample, the more power your study has. Another advantage of within subjects designs is eliminating random assignment. And if you get rid of random assignment, this actually increases your statistical power. So it's your research design's ability to detect differences between conditions. There are still some disadvantages of within subjects designs. For example, there might be maturation. There also might be fatigue of your participants. your participants might lose motivation and effort in the later trials. So they might show less effort at the later stages as opposed to the earlier stages. Now, one thing I want you all to note is within subjects designs are really a large portion of research in the behavioral sciences. They're the obvious choice to measure changes in behavior related to learning, maybe about training, forgetting, attitude change. You could track this within an individual. Now, sometimes you have to balance the order of conditions, and researchers really do this by using what we call counterbalancing. So basically, researchers use various approaches to balance the order in which participants experience conditions, because this gets rid of the biggest problem within subject designs, which are carryover effects. And the point of counterbalancing is to control for carryover effects. It doesn't eliminate it. And there are various types of counterbalancing. There's complete counterbalancing, partial counterbalancing, and Latin square. And there's also counterbalancing in which each participant has experienced multiple orders, such as ABA and block randomization. Complete counterbalancing, that's when all possible sequences of treatment are used the same number of time. Now, here's the thing. If you don't have a lot of conditions, this is easy, this is not a problem. However, when you run into a problem, when you add more conditions or a second variable, because you'll need more participants. So the one thing you want to keep in mind is counterbalancing may also apply to the order in which the dependent variables are completed. And if you have more than one dependent variable, you might be concerned that answering a particular dependent variable might bias an answer to a subsequent dependent variable. And if you want to counterbalance against that, you would counterbalance the order of administration of the dependent variables. If you want to guard against that possibility, you would counterbalance the order of the administered dependent variables. Now, partial counterbalancing is an approximation to complete counterbalancing, but you really don't do every possible treatment order. You would do as many random sequences as there were participants available, and you would randomly assign a different sequence to each participant. And this is really about controlling for order effects. And remember, counterbalancing presents some, but not all possible sequences in order to control order effects. Now, Latin squares is a particular kind of counterbalancing in which each treatment appears in each row and column one time. And there's an example right here on the screen, and we can go into more detail in a subsequent video. Now, there's also ABBA order, and this is what we call reverse counterbalancing. And basically, if participant is first exposed to condition A, then B, then you would reverse it and expose them to B and A. Now, block randomization, this is a counterbalancing technique used when participants are experiencing multiple conditions more than once. It works better when conditions are presented multiple times in order to balance out practice effects for particular orders. Now, a stipulation in this design is participants have to experience each condition once before being eligible to experience the other condition a second time. Conditions are randomized within a given block. Now, your most basic design is your single variable with two levels. So you have one single variable with two levels. Now, you can always add more levels to a single variable. Now, as I said, this makes it more challenging to do a complete counterbalancing. So you might want to do a partial counterbalancing, and you might run into issues with participant fatigue or lack of motivation. So you always want to keep that in mind when designing your research designs. And if you want to even get more complicated, you can add another dependent variable. And now if you have two dependent variables, then we could use a MANOVA, like we talked about in a previous video, which is a multivariate analysis of variance. And this is even more complex than the last previous designs we talked about. And you might want to do a MANOVA to see whether the same participants respond to these related measures differently across conditions. Mixed designs. Now this could include both a within subject and a between subjects. And things you want to keep in mind is order of presentation. You want to keep counterbalancing in mind, but keep in mind that some carryover effects might not be reversible. They might be irreversible. For example, if you have a treatment and you give somebody some kind of therapy, you can't reverse that treatment effect. Now, there is a pre and post design, and this is basically a design in which you have the measurements repeated at 2 time points, before the intervention and then after the intervention, or before your manipulation and then after your manipulation. Now, pre and post designs, they fall in the category of experimental designs. Now, there are single group pre and post designs, and this is where you have measurements before and after an intervention without a control group. Now, the issue you run into here is threats to internal validity. And some researchers say that if you don't have a control group, then these studies offer no scientific value. Now, there's also the experimental control pre and post design. So here you have random assignment, and you either get assigned to the experimental group or the control group, and they get a pre-test, the experimental group, and then they get an intervention, and then they get a post-test. The control group gets a pre-test, no intervention, and a post-test. Now, pre and post tests are great designs because you can, as I said, get a baseline measure as a pre-test, and then you could do your intervention and then see if there's been any change in baseline behavior or learning, whatever you're looking at, with a post-test. However, they're more time-consuming and they are expensive. With that said, I'll see you all in the next video. Take care. Bye-bye.